Alrighty, I think we're good to go ahead and get started. So, welcome to our CRISP overview and rural health connectivity program webinar. I'm actually going to kick it over to Rachel to do intros and then start us off with all of our presentation materials.
Yes, sounds good. Thanks, Kevin. It looks like we have a great group here. Good afternoon, everyone. Thank you all for joining and taking time out of your busy schedules to join us today to talk about CRISP and the Rural Health Connectivity Program opportunity. Before we jump into kind of the rest of this, a few housekeeping items. Number one, we are recording and we will share all of these slides and the recording with everyone after this. We will also post this on our YouTube channel. And just so everyone knows, all lines are muted to avoid kind of any distractions, but we do encourage you to type any questions at any time into the Q&A feature that we have here on Zoom. So with that being said, we are very excited to introduce the new CRISP Rural Health Connectivity Program. CRISP has partners with the state and the Rural Health Transformation Program to launch this with the purpose of strengthening and modernizing healthcare across Maryland's rural communities. And we do that by offering funding to both existing CRISP participants, and a lot of you here may be new CRISP participants potentially soon to help offset any costs that may come up during the process. Next up, I will introduce some of the CRISP team members on the webinar today. I am Rachel Miller. I am the Connectivity Senior Project Manager, where I am focusing a lot of my work and time on this program itself. Joining us is also Jessica Heslop, Director of Engagement Strategy and Outreach here at CRISP Maryland, Jessica Deagle, Lead Account Manager, and Cesar Pacheco, Outreach Integration Lead. And you'll hear from all of them a little bit later. Our agenda for this hour is kind of what CRISP is, who we are, for those of you who may be new to CRISP, what we offer, what the program itself is, next steps on how you can participate, and we will leave time at the end to address any questions you may all have. But like I said before, just pop them in the chat during the presentation. We'll try to answer them in the chat. If not, we will for sure have some time at the end to address those questions. And please do know if there's any questions that are very specific to your organization, we are happy to answer that. And you are more than welcome to send those over to our contact information, which we will share later on during this. And you can reach out there and send any of those specifics there. I think that's it for me for now. With that being said, I'll pass it off to Jessica to dive into our first agenda item.
Hi, good morning, everyone. And thank you guys for joining us today. We know that there's probably a wide range of people on this call, some who maybe are active participating organizations with CRIPS, some people who maybe are new, a variety of different types of organizations, primary care, especially behavioral health. We have some local health departments. We're really excited. But we wanted to start then this conversation with just some background, especially because we may be throwing out some terminology and explaining some steps within the CRISP process that some folks may be unfamiliar with. So to start, we'll talk a little bit about what is CRISP. So CRISP stands for Chesapeake Regional Information System for our patients. We are Maryland's designated Health Information Exchange, or HIE, and a health data utility. You'll hear that referred to as an HDU. And our main goal is to support providers, organizations, and communities by securely sharing clinical data to improve care, reduce cost, and improve overall health outcomes. So we also want to note, many people are not aware that CRISP is also a part of CRISP's shared services. So if we look at this nice little graphic, I think there's about 13 affiliate states or territories that CRISP is involved in. One of the great things is that there's a lot of shared infrastructure here. We can share our tools and services with other affiliates, but also have two-way learning. And if there are use cases in other states, we bring that back and try to find some commonality across much of the different areas which we're located. Next slide. So we use the HIE or Health Information Exchange quite a lot. And really, why is that important? Why does that matter? We really like showing this diagram because, as you all are aware, we can see that a patient, their experience in the real world is very diverse across different settings, clinics, hospitals, sometimes even different states. And our role as a health information exchange is to ensure that their health information or the patient's information really follows them rather than staying with just a single provider. Hopefully, this allows for safer, more informed care, perhaps faster care since you're able to have information more readily. We also play a big role in Maryland's public health efforts by supporting health equity, reducing redundant testing, and coordinating across care providers. Next slide. So when you talk about data exchange, there's a lot in that bucket. This is a little visual of a sense of the type of data we collect across the healthcare continuum. So we do aggregate and we have a wide variety of data sources, really robust in sort of hospitals and health systems. We also get lab data primarily from LabCorp and Quest, although we do have connections with independent labs or in-house labs. And we also get claims data from the state, so typically Medicare, Medicaid data, as well as some national databases, which we can aggregate their information. And that red box is sort of that's where our participants really come into play. And we look at the information that is shared by individuals with participating with CRISP, primarily under this patient panels. And I think later in this presentation, we'll go into exactly what that means, but a way to identify the patients that are under a certain organization's care. And really, when we look at all of these informations together, we're able to get that big picture, that full picture of a patient's journey. And again, hoping to bridge gaps where information may not easily flow from one of these buckets to another. Some of this data is lagged, like for example, claims, but then we also get real-time data. And you'll hear us talk about that. And it's one of the initiatives with this program for like admission and discharge data, things that are around diagnosis, medical information, medication, other formats. And by easily accessing this information, we can provide that real-time information to the next setting of care in which a patient may appear. Next slide. This is just a little sense of CRISP's reach. Honestly, these numbers can vary, but we process thousands, hundreds of thousands of clinical documentations. We have nearly 50,000 active users within our portal and just over 2,000 organizations. We also have that delivery mechanism of information in multiple different modalities. So, for example, we can deliver messages directly into an EMR. You can see that there's over 1.5 million deliveries in that system. We also kind of have alerting of messaging or encounter alerts. We also have many millions of those as well. And then we have just our bread and butter patient searching. Someone wants to find information about someone that they're seeing. Obviously, there's hundreds and thousands of that is done every week. So a wide range of types of interfacing and even representation of organizations that are already utilizing some of the CRISP tools. Next slide. So we also want to emphasize privacy and security since it truly is at the core of everything that we do. We do meet some of the highest compliance standards, complying to HIPAA, SOC 2, HITRUST, COMAR. There's a bunch of different abbreviations you'll see there, but we do have regular audits, cybersecurity testing, and do continuous monitoring. Those that are aware, we want to emphasize that Maryland is what's called an opt-out state. So we do want to make sure that you're aware that all patients are included in participating with the HIE unless they choose to opt out. And part of the enrollment is we ensure that providers give updated notices of privacy and protection and clear information to their patients if they become a participating organization with CRISP. So with that, I'm actually going to hand it off to my colleague, Jess Deagle, to talk a little bit more about what CRISP offers and highlighting some of the tools.
Yes, thank you so much. So yes, next slide, please. Okay, so CRIS service types. So CRIS services are built to support providers, care team, and the public health in different ways. And we like to break our applications and tools into 6 different categories. First, we have point of care, which is our most utilized tool, and it allows users to view patients' records, lab results, and care team information. Next, we have care coordination, which is our event notification system, and it alerts providers and patients are admitted and discharged, and to help teams stay connected and informed. And then through reporting and analytics, we use claims, public health, and clinical data to create dashboards that track outcomes and measure interventions. Public health is where we partner with state and local officials to provide the data and services they need to protect the community health. Program support, that's our team that supports Maryland policies by providing administrative support, spreading best practices, and making healthcare decisions more transparent. And finally, we have our technical integrations, and this ensures all of this is connected seamlessly for the clinical and administrative systems to pull and push data. Next slide, please. Okay, so who can access data on CRISP? So there's a few reasons you may be using CRISP. Treatment of a patient, public purpose, which is legislation or approved use cases, quality improvement, and care coordination. And this is for HIPAA and non-HIPAA covered entities. Research, which is approved by the state. And we did want to reiterate for the Rural Health Connectivity Program, it is only available for HIPAA-covered entities. Next slide, please. Okay, CRISP Core products. Next slide. Panels. So a panel is a list of active patients, and so your organization has already established a treatment relationship with these people. And panels allow CRIS to know which patients you're responsible for, so we can deliver those alerts that are relevant to your population. And it makes the workflow smoother across all of the CRIS tools and ensures you're getting the right information to deliver the best patient care. Next slide. Portal. So CRIS Portal is our web-based platform, and that's for accessing CRIS tools. From the portal, you can search for patients, view both clinical and claims data, and track alerts using tools like Population Explorer. And Portal is designed to give you fast, centralized access to CRIS data and applications. Next slide, please. In context. So the in context application in this slide is also called the Clinical Information Service in CRIS Portal, and this gives providers access to a complete picture of the patient's health by bringing together data from across CRIS networks. Next slide, please. And we're going to break down a little bit more of the clinical information tool. So within this tool, you can see demographics, you can see medication information, which includes PDMP and medications from CCDs, clinical data, which includes encounters, labs, radiology reports, vital signs, clinical notes, and so forth. Care coordination details, and this includes the patient's care team. Claims and social needs, such as overdose notifications or other social indicators, and my patient summary. Next slide, please. Okay, so there's 2 primary ways that you can access CRISP. So you can go through your EHR or you can go through CRISP Portal. So for your EHR, this is also referred to as in context, and it's built right into your workflow. And when you open a patient's chart within your EHR, the CRIS data opens automatically. And so it allows you to have the access right away. And that is what we're referring to as milestone 3 for the Rural Health Connectivity Program. And then CRIS Portal, on the other hand, that is our secure web-based option. You can manually search for a patient, and this gives you visibility and for additional tools that you may be using. But it also allows you to break glass on a new patient for your practice. Next slide, please. Okay, send. So this is referred to as CRISP Event Notification Delivery, and it's our internally operated alerting system that matches your patient panel against real-time hospital encounter data. Next slide. Population Explorer, that's where the send alerts basically come to life. So it's found directly on your portal homepage, and it provides a simple, user-friendly interface for reviewing your patient's encounters in that real time. And real-time notifications, as you know, it allows your care team to monitor hospital use, spot patterns, and take action quickly. Next slide. Okay, PDMP, so this is the Prescription Drug Monitoring Program database. This grants healthcare professionals direct access to track filled prescriptions of controlled substances, and PDMP helps prescribers, pharmacists, and public health professionals identify potential misuse and also ensuring that patients maintain appropriate access to their needed medications. Next slide, please. The consent tool. So the consent tool, this enables providers and patients to manage sharing sensitive health data such as substance use disorder, mental health information, and reproductive health information. And patients do have full control over their consent on this. Next slide. Imaging. So the CRISP Image Exchange, this allows authorized healthcare providers to view and share diagnostic imagings from a single secure location. So this improves collaboration and efficiency to care delivery. And the CRISP Image Exchange is available in both CRISP Portal as well as your EMR integrated in Context app. Next slide. Okay, so SDOH, and this is CRISP, Social Determinants of Health Assessment and Referrals. And this helps organizations capture, share, and act on patient social needs to improve their care. And next slide, please. Okay, so I know I went through everything a little quickly and just gave a brief overview, but our website is also a great resource for additional resources of everything that we have to offer. And you can find that at www.crisphealth.org. And I will pass it back to you, Rachel.
Cool. Thanks, Jess. I will kind of get into, now that we've learned a little bit more about CRISP and what we offer, specifics on the Rural Health Connectivity Program. As I mentioned before, we're really excited. This is the first year we're offering it. And so I will get into a little bit more of what this all requires. So next slide, please. The Rural Health Connectivity Program offers funding to eligible providers for connecting to CRISP with one or more of the following milestones that we have listed here. So milestone 1 is ADT feed, milestone 2 is CCD feed, and milestone 3 is in context. And in the coming slides, I'll get more into kind of what each of these are and the details there. Something important I want to note is it is not required to complete all 3 of these. So these milestones are essentially like a menu of possible connections. We understand that not everyone is in the place to set up all 3 at this point in time. And so with that being said, you're able to choose 1, 2, or 3 of them, and in whichever order you so choose. So it is flexible in that. And so that's just an important thing that I hope we can all keep in mind here. And the purpose of this program is to really just increase the availability of timely clinical data for your care teams and the rural communities you all serve. And a really important note is also that funding is available on a first come, first serve basis, subject to availability. And the first step is really to fill out the intake form, which I will get deeper into in a few slides. Next slide, please. First up is milestone 1 for this program. This is an ADT feed connection. When we say ADT feed, this is just a little bit more about what ADTs are. So ADT messages are healthcare update notices. So these are sent when a patient is registered, admitted, moved to a new location, discharged, or has any key demographic information updated. It gives the HIE timely encounter updates in kind of like a very standard format. So it makes it easier for organizations like yourselves to share important patient status changes across the care community. And a really important note about ADT messages is it does help power our send capabilities. Jess was talking a little bit more about send before. This is our notification delivery system. And ADTs really help provide that real-time event information that our send can use to recognize patient activity. It supports all of those notifications, all of those great alerts, and it connects other workflows for participating organizations. So that's milestone 1. Next up is milestone 2, CCDs. So a milestone 2, like I said, CCD connection. So a CCD is also known as a continuity of care document. It's essentially a structured snapshot of a patient's care that includes things like diagnosis, medications, allergies, lab results, procedures, discharge information, and all of that good stuff. And so sending in your CCDs kind of gives a fuller picture than just those ADTs alone. ADT messages are great because they show that a patient had an encounter. CCDs add the clinical details behind that event. And so that helps participating organizations better understand what actually happened during the patient's care. And so they kind of sometimes can go hand in hand and they work really well together. A CCD feed also improves care coordination across connected organizations. So by sharing those care summaries, organizations can reduce reliance on like phone calls, faxes, manual record requests, and it makes it easier to support transitions of care and follow up with that information. And last but not least is milestone number 3, an in-context connection. So in context brings CRISP directly into your EHR workflow. Kevin, can we go to the next slide, please? Thanks. So this EHR integration, what we call in context, preloads the current patient information without requiring a separate login or additional navigation. So it makes it easier for you all to view the HIE data in context. It saves time, it reduces the workflow friction if there is any, and essentially adding in context just means less clicks, fewer logins, less toggling, and it can help the staff work more efficiently. We have found that when CRISP is easier to access inside the tools clinicians are already using, so the EHR in this case, organizations are more likely to see consistent usage and stronger day-to-day benefits with the connectivity there. And we do support a range of EHR environments within context. And so here we have just a few of the top listed ones we can integrate into. Please know this is not a robust list, and we can take it on a case-by-case basis through the intake form, which I'll cover a little bit more later. And so a few that off the top of my head that we have are Epic, Oracle Health, aka Cerner, ECW, Athena Health, Meditech, Point Click Care. And we also do support multiple launch methods. And so this might be technical for some folks, but such as Smart on Fire and SAML, this enables the seamless integration into your pre-existing clinical workflows. Next slide, please. Okay, we've covered the top three milestones here. I'm going to get into a little bit more about eligibility requirements. And so eligibility requirements for this program to participate is being a HIPAA-covered healthcare provider that is either physically located in rural Maryland or primarily serves patients in rural Maryland. And we do have kind of a definition of what we considered rural Maryland in this case, and that is one of the 18 counties listed here on this slide. We also ask that you have the technical capability and just willingness to complete onboarding and program requirements, that of which we will get into in the coming slides. And I also want to once again emphasize that this is first come, first serve basis, and we can do this program, and it is available to organizations that have never connected with CRISP or who may already be a CRISP participant. Next slide, please. Okay. This kind of details the prerequisite requirements of the connectivity program. And so with these requirements, there are a few main ones, is just completing onboarding requirements. So this can include an NPP, PA, SUD forms, lab release forms, a W-9 for payment, panel submission, and an MOU, just kind of confirming the understanding of all milestones that should be completed and will be completed. And so once all of these prerequisite requirements are met, there is a $2,000 payment to your organization from us here at CRISP. We do ask that participants commit to maintaining data feeds for at least 1 year, or we ask that you may be required to repay the funds received. And so that's just an important note there. This slide is a great snapshot of a lot of what I already talked about. It covers the milestones and payments we've discussed so far. And so I do want to be transparent that this funding is offered to help offset those costs that may be incurred during the setup process. We do not necessarily reimburse or need any receipts. This is essentially a flat one-time payment. And we do I can go over a little bit more about the payments for each milestone. So we went over ADT feed milestone number 1. Organizations who complete that and have committed to that staying live for a year will receive a $7,500 payment. Similarly, with CCD feed connection, those who complete and keep it live for 1 year will receive a $7,500 payment. And milestone 3 is the in-context connection. This is a $8,000 payment. Last but not least is the FTE connection. And this is $500 per provider FTE. And for an FTE, we consider MDs, NPs, and PAs are eligible for FTEs in this program. And so with all of that being said, we have the FTEs. You can have up to 30 listed for your program or for your organization. And so if you were an organization new to CRISP and you would like to commit and do the work to help us set up the ADTs, CCDs, and in context, and you have up to 30 FTE providers, the max amount that you can receive through this program is $40,000. Next step. So this is kind of the program process here. So the first step is to submit our intake form. This is a pretty quick 15-question intake form. It's pretty simple questions, kind of like points of contact, who's your EHR, which milestones are you interested in, how many FTEs your organization may have, and your physical address. And so the best next first step, if you are interested, is to fill out that intake form. We will drop it here in the chat as well. It's also available on our website. After you submit it, we will review and confirm your eligibility. And then from there, we will kick off the onboarding process. So that's completing the prerequisite requirements we talked about before. And if you are already connected with us in some way, you may have already completed some of those prerequisite requirements. And so you won't have to recomplete them, which is great as well. And then we will work with you to actually complete those milestones and any attestation forms that were listed on the slide prior here. Those attestation documents are just really simple documents just meant to confirm that your organization is committed to maintaining the data feeds for at least 1 year and you have them set up and live, which we, of course, will help with. And then last but not least comes the payments for each one of those milestones that are completed. Next slide. Great. So next steps, like I mentioned before, if you are interested in participating in the program, please do fill out the eligibility intake form. With the information in that intake form, we can help determine your eligibility. And once again, just a reminder that funding is available on a first come, first served basis. And submitting that eligibility intake form is how we determine the first come, first served basis. Looking into the future, we also want to note that we hope to have a version of this connectivity program in the coming years. It will look very different. It might look slightly different, but it's going to have the same purpose of supporting interoperability of rural health communities. So please do stay tuned for that in the future. And then we do have all this information posted on our website, linked here. It also has a lot of other great information about just general CRISP one-pagers, video trainings, all of that good stuff. And then last but not least, as promised, I will open up the floor to any questions in the chat. Our team will answer them. And we are more than happy to answer any specific questions at the email address listed on this screen as well. Okay, I guess we can take questions.
It might be helpful. We did answer a fair amount in the chat already, but I just highlighting some that might be, useful to everyone. As Rachel mentioned, the list, I think on a couple slides back on milestone 3 does have some of the more common EMRs that we have partnered with, but that list is not exhaustive. So we have plenty more. We also are willing to explore new types of connections. As long as essentially we're able to do it, we'd be happy to connect. And we basically just highly encourage those to fill out the intake form so we can kind of go into that next step and do a more detailed sort of eligibility and feasibility kind of type of step with it. So want to do that. And then the other thing is that there was a ask about like the size of the practice. This is open to any size, whether you have, multiple locations and 40 plus practices, or if you're a single practitioner in one location, we want this to be pretty fluid and available to everyone. So there should be no limitation really when it comes to size. I think that was the most ones. Oh, we did get asked a question on like types of organizations, schools, for example. We know there's lots of school-based health centers in our eligibility criteria. I think the biggest one to consider there is if you are a HIPAA covered entity. That is our big qualifier in order to meet this. But again, encourage if there's certain scenarios, we're happy to address them one-on-one or take a peek based off of the information put in the intake form so we can better assess. Probably more that have come in. There are a couple questions about the links and stuff like that. We will try to drop links in this chat, but also when we send out communication after this presentation with the recording and the slides, we'll also be ensured to leave links and references in there. Oh, thanks. Rachel's dropping them in. There's another question about how do we find out which milestones, if any, we've currently completed. Likely there'll be someone in your organization that knows, but if you don't, you can always check it. And then again, upon review, and we've had some instances where people said, "Hey, I'm interested in all 3," and then we've like done review and said, "Actually, you've already are live with one. Let's just do these 2." So we're happy to review that. Again, the intake form is sort of the best way to sort of start that conversation so we can review it. And then the expectation is we would set up a kickoff call to go over that, answer any specific questions related to your practice, and really go over that exact exercise and say, "Hey, you applied for this, but this is what you're currently eligible for."
We have a question. Can an organization that does not currently have a compatible EHR but hopes to in the coming year also apply now? For this, we did have that list of EHRs that we currently integrate into. That is not a robust list. We also do work with other EHRs, so we recommend that you submit an intake form and list out your EHR there. If you are switching EHR vendors or EHRs in very soon, we do ask that you have kind of like a stable EHR that is like live now. And so like I said, we do hope to have some of this in the next coming years. So we would encourage you to apply if you have like an EHR switch in the near future.
Is a question about skilled nursing facilities. Some of those will have to be taken on a case by case. And just in general, we understand that there is a lot of rural health funds out there. There's some overlap with some prior programs. So our recommendation, and like I said, skilled nursing home is, I think, a good example because there is an existing nursing home connectivity program. We essentially ask you guys to reach out to us and we can kind of go through that exercise and see background and history and see if this is a potential option for your facility. There's a question about providers working at multiple practices. Again, some of this is a little bit case by case, and I'll give a couple examples. So in part of this application and sort of MOU process, we do ask for practices to submit NPIs related to the physicians, nurse practitioners, et cetera, that they are looking to get that FTE funding for. So we would not allow overlap for that same provider to be claimed in multiple different applications. That being said, some practices, for example, have more than one location, and a provider may do, part-time in one and part-time in the other. In that case, they would sort of be under one application, and of course, that full-time equivalent, they'd be eligible for that full $500 for that provider FTE credit. So hopefully that answers. Again, there's maybe some case-by-case examples that we have to take there, but we do want to ensure there's not essentially double dipping on duplication in that FTE funding. There's a lot in there. There's more to keep up with. Can a mobile or telehealth provider who provides care to the counties covered still be eligible? The answer would be likely. We do need to run some analysis to ensure that you meet eligibility. We say that the majority of patients by a practice or participant has to be within one of those rural areas. So that is something we're going to look for. Again, highly recommend just doing that intake form, and then we can kind of go from there and look at what's the best way to ensure eligibility. But in those instances, we would encourage that. And it's a great, I think, especially when you look at the goals of rural health and, providing or increasing overall interoperability and coverage for people who live in those areas. I think, telehealth mobile is a great thing there that we want to definitely encourage. There is a question about if you're already connected in all three ways, are you eligible? That would be no. So the milestones, if you already are connected and know, for example, like our hospitals, all of them are all connected in those ways, you would not be eligible for these funds. So it's only net new connections. And there is also about potential future funding there. So Rachel mentioned, and we are optimistic that we will have a version of this connectivity program throughout all the years of the statewide rural health transformation program. it may not look exactly like this. There might be different types of goals. We may pivot and look at data quality or data timeliness. Who knows? But we do hope that there is a version of this that may expand or slightly pivot some of the eligibility criteria. And, we hope to continue having these. And like I said, I think the success of this program hopefully will prove invaluable and that we can continue to look at adding to programs like this. Um, there's a question about CTOs. CTOs, the individual practices would definitely be eligible for that if you're participating with a CTO. We may need to just look a little bit about, multiple locations and stuff like that, but definitely encourage those to apply. And I think it's a great opportunity for especially practices that are involved in any value-based care that maybe previously that it was cost prohibitive to do one of these types of interfacing, especially embedding that CRISP tool into your EMR. This would be a great opportunity to hopefully be able to get that new tool. There's a question about practices if they're affiliated with a health system or if they're independent. Your affiliation is not a qualifier, so we highly encourage all to apply, whether you're affiliated with a large health system or not. Think we got through all those questions. Wondering if there's anything else. There's a good question here about first come, first serve. Hopefully we don't see it as a race to fill out the forms. We certainly want people to feel like they have time to digest. We feel pretty comfortable that there is a pretty significant amount of funds, hopefully to meet needs. If for some reason, and hey, we'd be happy then we get to a point where we have to pause in this, we'd absolutely communicate that. But currently, right now, hopefully, while we highly encourage first come, to express interest, we don't want people to lose out on that opportunity, but it's not like something that if you wait a week or two to digest, that we think that opportunity will pass you guys by. Another question about EMRs or EHRs. Actually, Kevin, do you mind going back a couple slides? We do have a list of the most common ones. That's not to say that we don't have other EMRs that we work with, or even EMRs, here it's this one, EMRs that we could explore new connections with. So we basically say, hey, fill out the intake form. We'll let you know. Some of them are really quick. Absolutely, we've done this before. Other ones we may be needing to have your guys' help liaisoning with your EHR vendor to explore the feasibility there. Think that's it. As mentioned, after this, we will send out the recording, the slides, and then some of those links to the intake form uh, as well as contact information and things like that. So, okay. Well, great. Thank you all. We really appreciate everyone's time today. And yeah, we're looking forward to this. And please reach out with any questions. Thank you all.
Yep. Thanks, everyone.